Greetings, everyone that's getting logged on. I'm seeing our ticker tick up. Welcome to our COVID-19 in Your Business webinar series. We're going to get started in, let's see, 2 minutes. 2 minutes. So welcome. We're glad you're here. I will say another welcome to those that have just logged in. Thank you for joining us this afternoon for the COVID-19 in Your Business webinar series. This is episode 7 that we've had over the last 2 years. So we're glad you're here. We've got about a minute or so, and then we'll go ahead and get started. But thank you for your time this afternoon. All right, everyone, I have 4 o'clock, so we will proceed. On behalf of your chamber, I'd like to say welcome to you. Thank you for taking time out of your afternoon to be with us this afternoon for the COVID-19 in Your Business webinar series. Again, on behalf of the partners that put this on, I want to recognize the Economic Development Corporation of Catawba County, the Small Business and Technology Development Center, and the Small Business Center at CVCC. We have it's been our focus to make sure that you have the most relevant and valuable information that's available to you in every ebb and flow of this pandemic, of this public and economic health crisis. And so today, we're privileged to have David Smith. David is no stranger to this series. He actually presented last year in 2020. But before we introduce David, I do want to intro this topic today. So on September 9th, 2021, President Joe Biden announced an executive order and related actions implementing new policies to address the COVID-19 pandemic. Several of the policies will affect private sector employers, specifically those with more than 100 employees. This announcement has raised many questions, and we've heard from many of you over the last couple of weeks regarding the what, the when, and the how surrounding this order and the required actions from the business community. Again, I want to say thank you to our great partners that have come alongside of us to make sure that you have the most relevant information regarding COVID-19, the pandemic, and how it impacts your business. But before we get started, a couple housekeeping items that I'd like to review. Just note that this session is being recorded, so we will provide every registrant with the recording link after the webinar once it becomes available. Also, we are going to be conducting a Q&A session with David following his comments and his presentation. So anytime throughout the webinar, if you want to click on the Q&A tab at the bottom of your screen, of your Zoom screen, you can type in any questions that come to mind regarding this order or any of the content that David has to share with us today. So you don't have to wait to the end. Go ahead and put those questions in. And Lori Alala, who I'll introduce in just one moment, we will be curating those questions and doing a Q&A with David at the end. So go ahead and type those in. So finally, I'd be remiss if I didn't say thank you to Broome Associates and also eBen Concepts for making this webinar possible. And to introduce David Smith, our speaker today, I'd like to recognize Lori Alala. Lori is our chair-elect of our chamber board, but also is a partner at Broome Associates in Hickory. Again, thank you, Lori, and thank you to the Broome team for bringing David to us today. So I'm going to turn it over to you to introduce our speaker.
Okay, great. Thank you, Lindsay. And I also want to thank the Catawba County Chamber of Commerce, the Small Business and Technology Development Center, EDC, the Economic Development Commission, and the Small Business Center at CVCC for your COVID-19 webinar series and efforts to protect and keep our businesses informed. So thank you very much for those efforts. In the last 18 months, they've been challenging to say the least. We have been in a constant state of change, and employers have had to find ways to adapt and remain compliant with all the new legislation that is passed, along with many executive orders at both the state and the federal level. So we do appreciate the guidance and the education provided by all of our local resources. So Lindsay, I want to thank you for that. I am Lori Alala. I'm a partner of Broome Associates, and our office is a division of eBen Concepts Company. eBen Concepts is one of the largest regional benefit consulting firms in the Southeast, and I'm pleased to welcome our presenter this afternoon, David Smith. David is Senior Vice President of eBen Concepts Company. His background includes work in both government and risk management and insurance industry. And since 2002, he has worked with employers and agents as a compliance specialist, a strategic thinker, and a consultant for large employer and self-funded group health plans. David has served in leadership positions at the local, state, and national levels within the National Association of Health Underwriters and the Association of America's Benefits Specialists. And he speaks nationally, focusing on educating employers, agents, brokers, and consultants. David has also been recognized as one of our industry's top professionals, having been named as the Employee Benefit Advisor of the Year in 2013. And in 2018, he was named the recipient of the Harold R. Gordon Memorial Award, which is our industry's highest honor. He's a graduate of University of North Carolina at Chapel Hill and North Carolina Central University School of Law. So David, thank you for sharing your afternoon with us and your time with us this afternoon. And welcome. I'll turn it over to you.
All right. Thanks, Lori. Thanks, Lindsay. Thanks everybody for being on. Because I'll probably say this a couple more times because I'm sure Lindsay and Lori will get this question more than a couple times. Yes, we will send you a copy of the slides along with the recording. It'll be a PDF, but then you'll have a copy of the slides. We're going to talk primarily about the vaccine mandates as it relates to federal contractors, healthcare facilities, what's upcoming from the temporary emergency standard, as well as what do we have an employee who's exposed. So some reminders on that one, as well as a brief discussion about healthcare premium differentials. To reiterate, Lindsay, if you have a question, please type it into the Q&A box. I will be kind of glancing over there from time to time, but I'm really going to try and focus on the slides and then answer questions at the end. So, as Lindsay said, on September 9th, the president announced 4 specific steps that he was ordering related to reducing the number of unvaccinated Americans. The first of those, which I'm not going to really talk about, requires all federal employees who work for executive branch agencies, they have to be vaccinated by November 22nd, or they will Sorry about that. Technology, no matter where you are, is always kind of sketchy. Don't know what the last thing you heard me say was, but most employees work for contractors, those details in the healthcare facilities piece. And finally, the part that requires, if you have 100 or more employees, to have all of your employees vaccinated or technically. I think one of y'all will speak up if you can't hear me, right?
Yeah, Dave, there is a little bit of delay. It's almost like a bandwidth internet.
Yeah, I'm sorry, I'm where I am for that limitation. Let me check one thing. Okay, I'm right there. I tell you what I'm going to do, which probably helps, is I'm going to turn my video off. And then that way I can just talk, and sometimes that helps, okay?
Okay.
And then that way you don't see my mouth running at a different space than my video. So thank you everybody for your understanding. So on the federal contractor mandate, the mandate is, that contractors or subcontractors will be required to comply with all the guidance for workplace locations where someone is working with or in connection with the government contract. What was interesting is the actual executive order signed by the president did not include people, but it certainly strongly heard, and as additional information kind of come out. They'll on this particular piece on September 24th. Now, for federal contractors, this mandate applies for new contracts or new solicitations, extensions, renewals, or options that go into effect on or after October 15th. And I'll talk about that in a second. Now, this is procurement contracts for services, construction, leasehold, or where someone's doing something under the Service Contract Act, concessions, or really what I would call public facing or employee facing in federal property. The exceptions are federal grants, contracts with a value of less than $250,000, contracts with tribes, as well as contracts for manufacturing under what's called the Walsh-Healy Act. I think the real consensus right now is anything that is a supply contract, someone who's providing goods, the federal government is will be covered by this. So if you're just providing services, yes. Goods, like somebody asked me the other day about jet fuel, again, that's a good, you're probably not covered by this. However, there was some guidance issued earlier this week that said that the federal agencies are being encouraged to add a vaccine mandate to their contracts going forward. So then the second part is always, what about subcontractors? And the answer to the question is, it will apply to subcontractors in the same way that the contract applies in the other. So for example, you have a services contract with a federal agency, and you have somebody who's doing sub work for you under that, they would also be required to comply with the vaccine mandate. I mentioned the October 15th day, and they're encouraging people to start that early. Now, there's a handful of questions that we think are still out there, like, will it apply to people working under the contract, or anybody who works for that company who happens to be under a federal contract? We don't really know the answer to that. And then the vendor prime contractors is another big.
Everyone, it appears that David's having some technical issues. Thank you for your grace and understanding. I think we all have been in situations before over the last 2 years. So thank you for your understanding as he gets his internet back up.
Don't know what's going on my end. Okay. It's what happens when you're in a hotel, right? Trying to work. So ultimately, that final piece about people who are working remotely, we don't know about. If you'll give me 1 second, Lindsay, I want to try and see if I can change the mechanism by which I'm connected. Well, I think I'm not. All right. So the second part of this mandate is for healthcare facilities. So this means anybody who works in a hospital, dialysis facility, ambulatory surgical center, nursing home, or other facilities that they are going to be required to vaccinate their staff as a condition of participating in Medicare or Medicaid. And so what we've kind of figured out is that that doesn't apply if you're just a general practitioner, you're just a doctor, and you have an office. This will not apply to you. It'll apply to facilities only. And the requirement is going to be that not only will clinical staff have to be vaccinated, it'll also be people who are under any services agreement, so an independent contractor working there, as well as volunteers, and staff who are not even staff who are not directly involved in patient or client care. So that means pretty much everybody. So, at the hospital, it's not just the doctors and the nurses and the nurse practitioners and the people working on the front line. This mandate is going to apply to people, even if they're in a billing capacity or somewhere they never talk to a patient, a resident, or a client. So it's a very broad mandate. What's not clear right now is whether or not this mandate will offer a weekly testing alternative. We think it will not. And what we also don't know yet is when this deadline will be. And so we'll continue to watch that deadline and wait for some other guidance about that piece. So on to the big one. So right now, the mandate that the president he's actually only issued an order to OSHA to adopt an emergency temporary standard, or ETS. That ETS would be for all employers with 100 or more employees, and I will tell you in a second about how to count the 100, to be either fully vaccinated, or if they're unvaccinated, they'll have to produce a weekly negative test result. So while there's been a lot of stuff in the media about this being a vaccine mandate for those employers, it is not. It is vaccine or negative test results. Keep in mind, OSHA cannot pass rules that apply to churches, state, local, or federal governmental entities, but it does apply to nonprofits. And so for that reason, OSHA's capability of doing this is very broad. The penalty for not complying, which they've said kind of initially, is $14,000 per violation. There was legislation that's been pushed, I believe, out of the House this week that would change that $14,000 number up to $125,000. But we obviously don't think that'll go into effect with this. But they have said pretty clearly they intend to enforce this, and I think they intend to make examples out of people as they do that. Keep in mind, this will not take effect until the emergency temporary standard is issued. And we don't know when that's going to be. My guess is sometime in late or early November. But for an emergency temporary standard to be issued, they have to show two things. The first of those is that there's a grave danger from the hazard, which in this situation is COVID-19, and that the ETS is necessary to protect employees from that danger. So they've got to show both of those things. And prior to COVID-19, OSHA's issued ETSs 9 times, and courts have either vacated or stayed that, meaning they stopped it 4 times, and they partially vacated it at least 1 time. So what I've said to people is this going to be challenged in court? Yes, absolutely, undoubtedly. Does it mean that we'll win? I don't know, because again, we've seen the Supreme Court recently grant or approve the Indiana University to require all of their students to be vaccinated. And so I think we can expect that mentality to be out there. It is important to understand that this does not affect any current union contracts. So if a union contract doesn't have anything in it related to a vaccine, it would not apply. How do you count to 100? Where you are saying that my part-time employees only count as half a person or anything like that. So ultimately, it is somebody's working full-time, part-time, that's 2 people. So 1 part-time, 1 full-time, and it is not by location, but on a company-wide basis. So you have a McDonald's franchise in 5 different places, you would add the employees of all 5 of those into 1 count. What is an interesting question, I know a couple times this popped up, there is not a black and white way to count how many employees is counting towards this. And so that's a problem. And it creates a couple different issues because, you know, if you're a company that's grown in size pretty rapidly, would you look back over the last 12 months and your average is now below it? You know, it's really interesting that OSHA has never really adequately described that. OSHA typically applies to employers with 10 or more employees. And so 100 was a totally different number. I also get the question a lot about common ownership, common control rules. And there's really two different ones, and they're both completely discretionary. The commonality is centralized control, centralized ownership, common management. All of those are really important. There is not a threshold of ownership the way that there is for tax rules. So you may have, you know, somebody who owns a company that does two companies that do totally different things that may not actually be considered a common workplace or under a common control kind of situation, and therefore would not be counted as a single employer. And so it's another one of those areas where there's not a lot of black and white answers. So what should you do now? I think ultimately my best advice has been we're gonna have to look at the rules when they're released. Tony, I'm gonna come to that question in a second. And determine, and I'd say look at your payroll records over the last 12 months. Because again, if you're gonna argue that you're not at 100, I'd have some information to back that up. And then look at whether or not the integrated employer rules would apply to you. The second is to really consider adopting procedures about how you determine employees' vaccination status. So how you're going to collect and ask the questions, how you're going to maintain the records, because the proof of vaccination is considered a medical record under the ADA. You do not need to ask for other medical or family history. And we'll talk more about that asking in a second. And then determine if you'll allow weekly testing as an alternative. The language seemed to imply an employer could say, we're not going to do weekly testing. It's going to be vaccine only. There are going to be exceptions for religious objections and also for medical reasons, which I'll talk about more in a second as well. But ultimately, if you're going to do that, the rule seems to be based on everything we've read that you're going to be required to actually, you, the employer, will have to pay for that testing. And the related part of that question is whether or not you'll have to pay for the time off that someone's going out to get tested to see if that is, and all of that really comes down to what I would call the when, how, and where question, where if you tell them be at this pharmacy at 10 o'clock on Monday for your test, if they're an hourly employee, you'll probably have to pay them for that time. If you say, come into work on Monday with a negative test result, then in that situation, you won't have to pay them for the time that they go to get tested, but it appears pretty likely that you'll have to always pay for the test itself. Have a plan for handling accommodation requests. You're going to have people who come in. You need to make it very clear that you've got a good policy on this. Say that you're going to not give everybody the same answer, that you're going to be individualized, confidential about those. And then you're going to undoubtedly have people that, and I'll talk more about this in a second, who say, well, I don't want to be tested every week. And that's going to be a harder one to get out of from an accommodation perspective. And I'll talk more about that in a second. And then also don't forget, OSHA still has all of its other pieces in place. So you've got to remember that they have the right to come in and audit, to do their investigations, to make sure that they're doing their inspection and everybody's compliant. And so that's going to be an area where, remember social distancing rules, masking if you're under any special rules because you're a healthcare provider or the like, all of those remain in effect, as well as any state or local public health orders. One thing that has come up and been, I think, a good suggestion that someone offered on a webinar we did last week was if you are hiring new employees now and you think you're going to fall into this category of being 100 plus, you may want to include in your offer letters a paragraph like this to make sure people are aware now that they may be required to be vaccinated or do weekly testing. And so a paragraph like this, I think, is designed to really kind of say to that new employee, hey, we're hiring you. And right now, we don't know if you're vaccinated or not, but come, January 1st, you're either going to have to show proof of vaccination or you're going to have to show us proof of a negative test result. And so I think going ahead and putting that in your notices is a good idea. Again, there are medical and religious objections that have to be recognized. Some people have, I think the medical reasons are pretty clear, and most of those are going to require a doctor providing some written justification for why someone has a medical reason for not being vaccinated. The hard part is, actually, I'll move on to this. So keep in mind, I just got my unstable notice, so I may drop off again. I'm just giving everybody a warning, but I'm trying my best here. You have to decide whether or not their objection is a personal choice or a sincerely held religious belief. So the law doesn't protect people who just say, I don't want to be vaccinated for a political, sociological, or philosophical reason. It has to be a religious belief, and it has to be tied to something that is sincerely held. And remember that religion is not just limited to Christianity, Judaism, Islam. Any kind of recognized belief system is going to be out there. I've been asked the question about a pastor writing a letter. I mean, I think you're going to look at each one of those on a case-by-case basis. And so remember that when someone says, well, I just don't trust the vaccine, that's not a medical reason. That is not a religious reason. That's just how they feel about it. And so your requirement under the law is to look at each of these situations through what's called an interactive process. So you should have a conversation with the employee, determine how valid the basis of the request is. So, for example, I've had a handful of situations of people who are practicing Catholics who have said, well, I don't want to do it. My religion says I don't have to. And then the Pope says everyone should be vaccinated. So those are areas where you do have discretion to say, yeah, but. And we all have employees who would probably try to abuse this, but just be mindful of that process. Also remember that you have the discretion to find a solution that is reasonable to everyone. You don't have to do just what the employee asks. So, somebody says, I don't want to take the vaccine for medical reasons or for, religious reasons. That's great. You have a very simple answer, which is the weekly testing. And I think that's probably going to be the most common thing. You're going to find situations where an employee will refuse everything you offer for them to do. And they want to pick and choose what they want to do. You're not required to do exactly what they want. And if they don't want to be reasonable about it and they don't want to, again, no undue hardship, then you may have no choice but to say, I'm going to put you on unpaid leave until, it's safe for people to return to work. And so I think you just got to be very mindful about that process because it is not easy. So as it relates to privacy and confidentiality, because I've run into a bunch of these questions, individuals. Health information protection has some exceptions, and public health and workplace safety are two of those exceptions. So HIPAA is good to go. And so I don't think I would worry about that issue as much as people might want to make it an issue. Then the second thing is, remember that under ADA rules, that vaccination information is medical information. And so it can only be disclosed on a need-to-know basis. And one of the things I think we've kind of been very mindful about is how you ask people. And then once you get an answer, you don't do follow-up questions. So have you been vaccinated? Yes or no? No. Okay, so, okay, no, you haven't been vaccinated. Here's what we require you to do each Monday. Don't, not ask questions like, why not? Or when are you gonna plan on getting vaccinated, or any of that's not really the place of a supervisor or anything else. I'm sorry, I have a bad habit of looking questions, so I'll try and hold that one out. If they, you can't ask what they're going to do in the future. You got to remember that vaccine status is confidential medical information. You can ask for a copy of the card, that's okay. But again, that's medical information that has to be treated accordingly. And that means putting it away from the general employment file and the like. So, and the mask wearing situation, one of the questions that came up back before we had really the rise of Delta and some of these issues has been, well, what if I want to make sure that me and my other coworkers know who's been vaccinated or not? Can we put something on their name badges? And the answer to that question is no, you cannot. The only thing they've kind of suggested is if you wanted people who were vaccinated to wear like a wristband, but not a wristband that says, blinks on and off that says vaccinated, but simply a colored wristband, then in that situation, that would be something that wouldn't be obvious about whether or not there is that person's status is vaccinated or not. So the who pays for testing question. This has really been a major issue, and it's a major issue because a lot of us have sat here and thought, well, the law CARES Act mandated that health plans pay for testing. And what we've seen evolve over the last few months is that it does pay for testing when it's medically necessary. So someone's showing up, they have symptoms, they've been exposed. Those are areas that are considered medically necessary. But for what's called surveillance testing, there is no mandate. And we've seen a lot of carriers in particular start denying the payment of this. And so if you're going to have to pay for it, then the question is going to be how. And I think that's one of the big areas that we're running into already. And I know that the president has put in place an emergency manufacturing order related to testing. A lot of testing is necessary, but we're already seeing both the price to vary as well as the quality to vary. We're trying to work with local pharmacies, national pharmacies, local health departments about getting and being able to do the testing. And so just be aware of that as far as something you need to be prepared for in dealing with it. So I'm going to transition quickly to talk about the close contact rules because these questions keep coming up. And then I think I will stop and take a few questions and we can start wrapping down a little bit. Remember, close contact means that someone has been within 6 feet of someone who's been infected for more than 15 minutes collectively, up to 2 days before that person got sick or had a positive test result. And so that close contact, and this assumes, and I'm sorry, I forgot to throw this caveat in there, this assumes that both were unmasked. And so if both were masked, then totally different kind of set of rules. So what the CDC said, and this is the latest guidance they've issued back in late July, that says if someone has a positive test result, they have symptoms, they've had no test or a negative test, but they have symptoms, or if they've been exposed and have symptoms, so symptoms, then that person should quarantine for 10 days from the onset of the symptoms and stay quarantined for at least 24 or more hours since resolution of the fever without using Tylenol, Advil, other fever-reducing medicines, and also show improvement of other symptoms. The other way of doing it is that someone has had 2 negative tests in a row taken at least 24 hours apart. That same rule applies for positive tests, but no symptoms. And so quarantine for 10 days unless they have the 2 negative tests taken at least 2 days, taken at least a day apart. The other thing to keep in mind is if you've had close contact with someone who's tested positive, no symptoms, and you are either vaccinated or you've been COVID positive in the last 3 months, no isolation is needed immediately. You have to be tested within 3 to 5 days. wear a mask in public indoor settings for at least 14 days or get a negative test result. If you're not vaccinated, 10 days after exposure or 7 days if a negative test result is obtained. So that piece is very important. That's a good sheet to kind of keep out and look at. Remember the difference between quarantining and isolation. Quarantining is that you're staying home, but that's when you're really trying to protect yourself. Isolation is when you are supposed to stay away from people, household members. You don't leave home unless you're going out for medical treatment. Isolation is a much more serious level of this. So I think I will stop and answer some questions. And then if I need time, I can come back and answer questions about Delta, but otherwise I will listen up.
Okay, David, I'll jump in and just say, Nathan Hewitt asked a question about the ability to get the slides if they did not pre-register. Yes, if you will put your email address in the Dropbox or in the chat, no question section, then I will send that to you. And then the other question I think we need to focus on is from Kimberly Richards. Is there any guidance yet on how 100 employees will be defined? I know you briefly touched on that. And then she went on to say on a specific day or month, or is there an average over a period of time? FTEs or actual head count, seasonal and temp staff counted. So maybe talk for just a minute about how 100 employees will be calculated.
Well, so what I would say is you're going to look at your payroll records per pay period. Seasonal will count, part-times count, everybody's a whole number. So you're not going to do fractions of people. You're going to look at your payroll records. In my mind, you're going to look over the last 12 months. I believe we're going to get more guidance about how to count to 100 out of the ultimate emergency temporary standard. But it's really how many people did you pay in a particular the questions that came up previously, independent contractors who are not employees, and so obviously they wouldn't show. But I think if you pay them, then they are counted as one, and you got to look at what you paid each pay period, probably over the last year, just to kind of have a justification for it not being close.
Okay. So it sounds like all the employees will count.
Did I answer all those, Lori? Yeah.
Yes.
Did I answer all of her pieces there? Okay.
Yes. So to repeat this back to you, it sounds like all the employees will count full-time, part-time, would be a total collective number.
Yes, that's right.
And then who will pay for the weekly test? Of course, the employer is going to be responsible for paying for the cost of the test. And then will employees be eligible for unemployment if placed on unpaid leave of absence?
And
David,
the answer to that question is it's actually a great question. Ultimately, your ability to make sure they don't get paid unemployment is going to come down to your adopting a policy saying that people have to be vaccinated or tested. And what the state has said, what a handful of other agencies have said, is if that person is they're unemployed because of the fact that they refuse to get vaccinated or refuse to submit to weekly testing, then they would not be eligible for unemployment payments.
Let's see. Okay, so another question, can the employer choose not to allow the testing, opt out?
That they can choose that. They can choose to say we're going to do vaccine mandate only. And if people don't have a religious, a sincerely held religious objection or don't have a medical reason, then it would be okay for them to be on unpaid leave until it is safe for them to return to work.
What about employees submitting COVID tests on their own, David? Is there best practice for that? Because you don't want employees to just be taking pictures of COVID tests and sending them to HR folks and submitting the same picture, over and over 3 times. So
I think this is going to be one of those areas that get very interesting, Lori. I think that as I've thought about this, I think we had a question last week about somebody saying, what if they send me the same picture every week? Unfortunately, the way that, phone cameras work, you got a time that picture was taken. So it's a little harder to do. I think a part of it's going to come down to, if I'm the employer, number one, you want legitimate results and you want to show that you're being diligent about getting legitimate results. But I think you also want to be cognizant of the fact that there are $7 tests out there, there are $35 tests out there. And so how are they, if they want to do that and get tested on their own time frame, then that's great. Just remember, even if they go get tested on their own, you'll have to reimburse them the cost of that test.
Right. So it's best to just set a standard and stick to it.
Yes, ma'am.
And apply it across the board. There was another question that came in. What if you live with a COVID positive person? I'm sure that refers back to the symptoms slide that you just showed.
I think if you're living with someone, I'm trying to not be my usual kind of self here. If you're living with someone and they're COVID positive, I think that's going to count as close contact, and you're going to have to follow those rules about isolation or quarantine based on these standards before you return to work, and you should tell your employer. I actually had an employer who had an employee who came to work who knew they'd been exposed. They had a COVID test later on in the day. And it's like they came to work. And so again, one of the things we've said to people is you might want to really clarify to people, hey, this is, if you don't come to work if you're COVID positive or if you've been exposed, because then you're going to wind up exposing everybody else.
So a clarification to that question is, what if the person who's been exposed has been vaccinated and they live with that COVID positive individual?
So that would be that bottom green box. So they would not have to be isolated. They'd be tested within 3 to 5 days and wear a mask. So that's where they fall into.
Okay. And do you know how this is going to be monitored? How
I
they
don't
will monitor? Okay.
I don't. That's one of those areas that I think we've got a lot of questions, because I don't think any of us want OSHA creeping around any of our places of business. But my suspicion is that they'll start sending out letters pretty quick after the thing goes into effect to start saying, hey, let's see your policy. Let us see some records of the fact that you're asking for vaccination records or that you're getting negative test results. So I think that's how they're going to do the enforcement.
Okay. And temporary employees, staffing agencies. So if you hire a temporary employee from a staffing agency, whose responsibility is it for that particular employee? The staffing agency or the employer who has secured that staff member?
Based on what we can tell, the answer is going to be who pays them. So if you're a company and you go out to ABC Staffing and they bring 3 people and they're working for you, but you're paying ABC Staffing's paying those 3 employees, their vaccination status is going to be on the temp agency. That's the way we understand today. The second you hire them from the temp agency, then they become your responsibility to get vaccinated.
Okay, another interesting question that's come in is, it reads, my company does have a location with union workers. Are we able or unable to mandate the vaccine testing unless it is in their union contracts? So now we're talking about union contracts being a part of the equation.
That's right. And I think the early indication, at least the information that was provided immediately after the president's announcement, was that the emergency temporary standard was not going to require vaccination or testing when there's a union contract that doesn't permit it. I think that's going to be an area that there's going to be probably a great deal of consideration, discussion, because it kind of doesn't make sense. But I'll go back to the Major League Baseball example, even NFL, where the absence of having a specific requirement has created some problems in getting athletes to get tested. So I think it is a concern. And I don't know that we know a straightforward answer to it other than the fact they said, well, we're not going to make people change union contracts to be compliant with this.
Okay. Thank you, David. That's all the questions we have open right now. I'll let you get back to the slides so we can finish the presentation in a timely manner.
So I was going to briefly mention Delta Airlines because a lot of people have asked this question. They've said they're going to charge unvaccinated employees $200 more per month to be on the health plan. And they basically have indicated that that's going to go into effect, quote unquote, later this year. They reported last week that some significant percentage of their unvaccinated employees had already gone and gotten vaccinated because of this particular $200 deal. But remember, if you decided to do something like this, you're at the weird intersection of things under the IRS, Centers for Medicare and Medicaid Services, and the Department of Labor's responsibility. And also then on the other side, the EEOC's pieces related to ADA, the Americans with Disabilities Act, and the Genetic Information Non-Discrimination Act. And so ultimately, you got to remember, if you put in place a rule related to this, the wellness incentive rules could apply. And so you got to remember that if you have a standard like you must be vaccinated, that is more than likely going to be considered a health contingent wellness program that you'd have to offer a reasonable alternative. And we have no earthly idea how that's going to work. And so that's been one of the first complications and a reason why we wonder how they're going to implement it. The second is, how much do you do as a surcharge? And so under the HIPAA ACA rules, you can charge non-compliant folks up to 30% of the cost of coverage, the premium, for being non-compliant. And those could be things like tobacco use, completing HRA, not getting vaccinated. And so you do have some flexibility on that piece. But don't forget that if you are a large employer, 50 plus ALE group, you have to keep in mind affordability. And ultimately the affordability number is whatever the non-compliant cost is that is not tobacco related, which sounds complicated. But in my example here, you got a base plan, you got a buy-up plan. And if you're on the base plan and you're compliant, so you're not a tobacco user and you're vaccinated, you pay $20 per week. If you are vaccinated but a tobacco user, you pay $40 per week. So for those two groups, then affordability is based on the $20 per week. If you're an employee who's not vaccinated, or you're an employee who is a tobacco user and unvaccinated, while that tobacco user unvaccinated may have to pay $60, affordability based on 40. And so you can see how that really starts to change things in terms of $20 per week is affordable because it's below the federal poverty level. But when you go to 40, now you got to go up to anybody making less than $11.17 per hour is going to be considered unaffordable. And that number will jump up to $11.41 next year whenever the affordability percentage change. So it's an important aspect of this conversation, and we're looking at it on a case-by-case basis. Also remember, you cannot give a wellness incentive that is quote unquote so substantial as to be coercive. So we believe that the EEOC has already kind of indicated to Delta that they're going to have a look at this before they decide whether or not they're going to take action. And then the fourth part of it is, again, the discrimination issues that we've talked about previously. What if you have someone who can't get vaccinated because of a religious belief or a medical reason? You're not going to be able to do that $200 per month surcharge for those folks. So as you look at this, remember, you can only do a higher premium on the employee only amount or whatever the employee portion is. You can't charge more because the spouse hasn't gotten vaccinated or the family hasn't gotten vaccinated. You'd have to do a flat $20 per week on each tier. The other thing is, if you're going to add this amount before renewal, you have to provide 60 days advance written notice before you can put it into effect. And then ultimately going back to one of the biggest questions we got out there, which is, What happens if someone brings you a fake vaccine card? What are you going to do? And I think that's going to be something that is definitely a concern. But all in all of these things, we've already done some work for our clients on vaccine mandate model policies. And so you can touch base with Lori about those for clients. Sorry for coughing. I'll be glad to answer any more questions. But please don't hesitate to ask them. I'm going to go back on mute for a second.
David, there was a question about what federal agency will monitor or audit the compliance.
That will be OSHA. So the
OSHA.
Occupational Safety and Health Administration, who is under the Department of Labor. They've got primary regulatory authority over the 100+ employer mandate. The piece for medical healthcare facilities will be under CMS.
Right, because they receive Medicare and Medicaid funds, right?
That's correct.
Yes, I think a real key takeaway from me was that they have to provide 60 days notice before a policy goes into effect. So do you think that this will go into effect the end of November, or what's the anticipated timeline?
If I had to put money on it, because they've got to go through a process in terms of submitting it, putting it into place and everything else. The 60 days I mentioned there at the end was about doing an off-cycle increase in premiums. I believe they can probably do an emergency temporary stay with a 30-day notice rather than 60. And I believe that the earliest that would go into effect would be December 1st. I think there's also a very high likelihood, Lori, that by the time that this comes out and gets done, that some of the worry about this may have also dissipated as well. There are a couple other variants out there, but I think that ultimately you've got a big, strong push about getting this done, but I don't think that the process is going to allow it to happen too quickly. And even if they did have something ready by December 1st, I can pretty much guarantee you they will find a federal district court judge who will issue a temporary restraining order on the enforcement of those of this ETS until after it's been adjudicated. So that will happen almost immediately.
Okay, so employers should really put a plan in place in an effort to be prepared for this. But do you think it's going to be December at the earliest, December 1st? And
yeah.
And then if it's contested, push back until a later date, of which we don't know.
That's right. And I think for me, the best kind of now thoughts are look at your payroll records, figure out if you're very clearly under 100 or very clearly over 100. Those will be kind of easier. If you're going to be right in that kind of gray area because you got a bunch of seasonal employees, a bunch of part-time employees, those are the ones you're really going to want to look at, figure out whether or not you got to do it. And then if you're pretty certain you're going to have to do it, I'd go ahead and start telling new hires about it now.
Yeah. And then make the decision too, if you're going to allow just straight vaccination requirements or accommodate with testing for those who choose not to get vaccinated, right?
That's correct.
Yes. Okay. And we are looking at testing options for employers as well. I know that's one thing that the Chamber has been investigating as well. And I think we'll have some solutions soon for that.
So Lori and David, I want to say thank you. We will pause for just one more moment. If you have an additional question, feel free to use the Q&A or the chat. We'll make sure we get your questions answered.
One of the questions that has been asked is who will be the most likely parties to raise legal challenges?
I would not be surprised to see some members of Congress do it. I think there'll be a handful of people probably lining up. They're probably already lined up right now, ready to issue the challenge whenever it comes. So I think there's not any lack of people who are going to do it. I suspect you're going to see some business organizations do it on behalf of employers. And so I think that's going to be a place that you're going to see some action in terms of that. But my suspicion is that those lawsuits have already been written and just waiting to get filed.
Wow.
Well, on behalf of the Chamber of Catawba County, also the Catawba County Economic Development Corporation, the Small Business Center at CVCC, and the Small Business Technology and Development Center, I want to say thank you to David for his time this afternoon. And you overcame those tech challenges, David, with grace. And those of you that are watching, I appreciate your grace that was extended to us. I noticed eBen Concepts, your tagline is "You make complex simple," and I think in hearing today's presentation, that is certainly evident. So we appreciate your expertise in following this information.
And again, I apologize for the tech issues. It seems like always something to chase.
No need to apologize for something you cannot control. So again, Lori Lala, I want to say thank you to you and also Broome Associates and their whole team for partnering with us to bring forth this information. We will continue to monitor this. If you do have questions that went unanswered today, or you sign off and you think of something later, you can always email me, lkeesler@catawbachamber.org, and I will go to the experts and get your questions answered. Also, just a reminder, this session is being recorded, and so you will receive a link to that recording as soon as it's available. So without further comment or question, we will stand adjourned. Again, thank you all for taking your time to be here.
Yes.